I'm Rebecca Macfie. I did this study when I was a general surgery resident at Oregon Health and Science University in Portland with Dr. Rod Pommier, who's a professor of surgery and a surgical oncologist there and an expert in neuroendocrine tumors. So our aims are really threefold. The first was to look at the incidence of carcinoid heart disease or CHD in a highly screened population of patients. The second was to determine outcomes of patients treated for CHD by valve replacement with or without liver debulking. And the third was to evaluate whether there's any protective effect of octreotide therapy for either developing or having recurrence of carcinoid heart disease. So this was a retrospective review of our prospectively maintained carcinoid database at OHSU, looking at patients from 2001 to 2021. So in 282 TTE screened patients, we found that there was a 14% incidence of carcinoid heart disease in patients with metastatic disease and 25% incidence in patients with carcinoid syndrome. CHD patients with valve replacement operations had a 0% operative mortality and longer-term survival of up to over 230 months. And our data did not support the protective effect of octreotide therapy. So I think this really makes a compelling argument to lean on our colleagues in cardiothoracic surgery to perform these valve replacements in patients, even if they have inoperable liver disease, which certainly challenges many of the paradigms we think about in terms of sequencing care and who should be eligible for which types of operations.